Liverpool's been an innovative and groundbreaking unit for developing surgical reconstruction in head and neck cancer for a number of years. And through my predecessors, David Vaughan and James Brown, I've now stepped into the role, and we offer what we think is cutting-edge reconstruction. And where patients in the past would often have upper jaw tumours removed and merely replaced with an extension to a denture, so that's called an obturator. A lot of patients didn't really like that, and long-term survivors found it quite difficult for their quality of life and speech and swallowing. And so one thing we've been advocating for years is to reconstruct the defect with what we call a free flap. So it's vascularized tissue from elsewhere in the body, and actually to reconstruct with bone and then to build the teeth on dental implants. So that hasn't been a common treatment up until recently in many parts of the world, and it is technically complex. But we feel that the benefits to the patient of offering them full rehabilitation start with initial treatment planning, and they start with the day that the tumour is removed. And so my lecture really addresses that, and the Liverpool unit has been asked to host a session on reconstruction with a Toronto unit and to talk about the various methods of reconstruction. So the costs are there, and the operations to offer simultaneous removal of a tumour and reconstruction with a composite flap will be in the realms of 10 to 12 hours. So that is a substantial cost, and often a two-team approach. So you've got at least 2 surgical teams and sometimes the input of a dental specialist as well. So I'm sure the costs are there. Put against the costs of complex drug treatment, I think they're more or less equivalent.